The medical interns have been on strike since November 8th because of the delay by government to enhance the allowance as it had been promised following the directive by President Yoweri Museveni. According to the Secretary General of the Federation for Uganda Medical Interns, Dr. Nabushaw Faith, they are convinced that this time around the money is finally going to come.
Though at first some medical interns kept insisting that they wanted to first see the money on the accounts before they could resume work, but as leaders we had to convince them because we were really convinced that the money is coming, and finally we've been able to to reach a conclusion. As medical interns, we'll be reporting to work effective tomorrow, and we'll resume our duties as usual. As we wait.
The intern doctors, on the other hand, say if the money does not reach their accounts before Christmas, they will resume the strike.
The money that was discussed in this meeting, it was exactly according to the President's directive, because in this meeting we were shown that the intern doctor is now to earn 2.5 M monthly, which exactly half of the recommended pay of our immediate seniors in the profession, and the intern pharmacists and nurses are to get the exact half of the recommended pay of their seniors in the profession. So we are really excited and happy as medical interns that finally the presidential directive has been implemented.
This development comes a few days after the medical interns and other leaders of Uganda Medical Association were arrested by police on Wednesday for holding an illegal procession as they marched to take their grievances to Parliament, but they were released on bond on the same day. Doctors under the umbrella body Uganda Medical Association, led by the Secretary General Dr. Swata, also revealed that they are still in talks to decide a way forward. As medical interns prepare to return to work, approximately 10,000 medical laboratory technicians in the country have announced a strike which goes in effect tomorrow. The lab technicians are striking over low pay. The Secretary General Uganda Medical Laboratory Technician Association, Dr. Dennis Alibu, says they have held several meetings with senior officials from the Ministry of Health and Ministry of Public Service to discuss concerns, but all the meetings they have held have not yielded any fruits.
As you're aware, the strikes that professionals have had in the country, government tried to enhance salaries of health workers. But like you compare the level of exposure the health workers have, and particularly the laboratory professionals, we deal with the disease-carrying agents. We're directly in the attack with these infections. The payment, we feel, has to be revised to match our level, particularly the graduate level, and also the parities in the salary scales. I want to give an example. The lowest salary scale for health workers is U7 in government, and that's a certificate holder. And then we have U6, we have U5, U4 upwards. Now, for lab assistants who are at U7, take home 800,000. And then we have the diploma holders who are at U5, take home 1.2. One of the concerns is that there is a big range in between the two scales.
They have now asked their heads of department to organize a small team that will handle emergencies.
To make it clearly that this intended industrial action is for civil servants. We are not students either, not interns. These are active in-service professionals who have been patient enough. For your own information, I think you've never heard of a strike from the medical laboratory fraternity before. This is the first time ever we hold a strike or industrial action, to put it rightly. So by the time we come out, it's too much. This is an association that has been in existence for over 50 years. And time and again we've had different leadership that have kept on, handling things in a diplomatic way with government. But this time around it's been too much. That's why we've come out as medical laboratory professionals in the country.
It is the first time laboratory technicians are going on strike. Some of the issues these want addressed include refurbishing and equipping dilapidated laboratories in hospitals, compensating families of lab professionals who died in line of duty during COVID-19 response, filling vacant positions, introducing internship training for lab graduates, providing housing allowances, and appointing lab officers who head services at district level. The report is compiled by Shamim Natebwa for CTV PM Edition.